become robotically trained, surgeons have to go through rigorous training. This includes online didactics, courses, and hands-on training in the operating room. At the end of all that training, the surgeon has to show proficiency in completing operations both at the bedside and on the console. The most common procedures I perform on the robot are anti-reflux operations for people who suffer from a chronic heartburn, weight loss surgeries, which include the sleeve gastrectomy and the Roux-en-Y gastric bypass. I also offer taking out bands for patients who are suffering from complications related to their band operations. I also perform cancer operations using the robot, which include resection of parts of the stomach, parts of the pancreas, the colon, and the small bowel. I also perform bread and butter surgery using the robot, such as taking out the gallbladder for people who suffer from gallbladder disorders, hiatal hernias, abdominal wall hernias, and groin hernias. So the robot works in an interesting way. After the patient is under anesthesia, we place what we call trocars into the abdomen. These can be about 3 to 4 trocars, sometimes 5 trocars. The trocars serve as a telescope from the outside into the inside of the abdomen. They provide the road map for the robot to dock onto the abdomen. And then the robot is docked onto the abdomen to these robotic trocars. After that, the surgeon will scrub out and go to the robotic console. So the robotic console provides the surgeon with a high-definition 3D reconstruction of the surgical field. And then it also has 2 working hands for the surgeons. And then the surgeon is able to operate remotely and able to control the robot, which is attached to the patient. A lot of patients have the misconception that the robot will operate independently without the surgeon, and that is not true. The robot is simply a tool, just like the laparoscope, that will allow the surgeon to perform the operation through small incisions. I think the robotic platform provides a lot of benefits for me as a surgeon. One, I get to have excellent visualization of the surgical field because of the 3D reconstruction and the excellent optics provided by the robotic telescope. The robotic instruments are able to eliminate hand tremor. So when we combine all those benefits together, we're able to perform a lot of our operations in a very safe and efficient manner. Also, the robotic platform opens a lot of avenues for operations that were done laparoscopically but with difficulty due to the complexity of the procedures, such as surgeries on the pancreas and the colon, and surgeries on hernias, which have become much easier using the robotic platform. From a patient's perspective, the robotic platform is able to provide them with smaller incisions that allow the patients to get to their normal functionality sooner than expected. So the recovery is much smoother, the pain control after surgery is less of a problem, and the need for narcotics is minimized. When you add all these together, patients are able to get home much faster than what we traditionally would do with open surgery. Some patients don't qualify for robotic surgery, and part of my training is being able to provide open and laparoscopic surgery as an alternative for their disease process.